everybody, Dr. Alec here with Culction Chiropractic. So today we're going to shoot a video where Mike asked me some questions. I don't actually know everything he's going to ask me, but I think try to answer some questions about chiropractic care honestly.
Yeah.
And in a helpful way. So let's see what he has.
Some chiropractic FAQs, if you will, with the one and only Dr. Alec. So first up, what is chiropractic care?
In my words, chiropractic care is a non-surgical, non-pharmacological, typically manual intervention in a musculoskeletal dysfunction or pain. So that could take the form of joint manipulation, it could take the form of soft tissue manipulation, and in the state of Maryland where we have PT privileges, it could also look like using any of the gadgets we have like Shockwave, Class 4 laser, and STIM. It could be utilization of all the experts we have on the rehab floor. So yeah, chiropractic care, frankly, especially in the state of Maryland where we have this scope, it doesn't look radically different from course of physical therapy, but we employ more, I would say more manual techniques than a physical therapist would on average. Not to say that that's like the rule, but I find that we're a little more hands-on than the PT counterparts that we have.
Sounds good.
Yeah, that's my answer.
So I think I know the answer to this next question, but I'm going to ask anyways. Is chiropractic care safe?
Chiropractic care is exceedingly safe. Just to address the elephant in the room, I think the big concern that folks have is, oh, am I going to have a stroke or be paralyzed? I think that's the thing, that the worst case scenario that gets conjured up in people's minds. And some really big organizations have done like multi-year longitudinal studies on this. And the conclusion is that we certainly are not positive in these like these neurological events, these vascular events. What has essentially been determined at this point is that people with head and neck pain present to a chiropractic office, just like people with head and neck pain present to the primary care office. Because most of the studies are comparing incidences of like a cardiovascular event or a vascular event after visiting a chiropractor versus visiting their primary or a medical doctor. And what they've essentially found is the incidence is virtually the same, although the medical doctor never touched them. So what this kind of tells you is that there's a temporal and not a causal relationship between manipulation and like a cardiovascular event associated with chiropractic.
Right on.
Yeah.
And obviously we see a plethora of different conditions. What would you say are sort of the bread and butter, or the most commonly treated here in the office?
Dude, bread and butter. Bread and butter is mechanical back pain, mechanical low back pain, which just means back pain that is the product of prolonged periods of sitting or repetitive stress. I would say neck pain, just broad sweeping neck pain is probably the number 2. Everyone is sitting now. Dude, so yeah, if it's not spine, which is like the thing I think people make synonymous with chiropractic care, it's going to be stuff like plantar fasciitis. It's going to be like anterior front-sided shoulder pain, secondary to lifting. You know, it's going to be like a hamstring strain, Achilles tendonitis, tendinosis, golfer's elbow, tennis elbow. So just like really common athletic extremity issues are probably the things we see behind low back pain and neck pain. So I know that's not specific at all, but there's a lot there. People come in for everything.
So the combination of injuries with cumulative type build up as well, huh?
Yes, because like I think a lot of people forget that stress could be either, when I say stress on a tissue, that is either a one-time, there's 3 things. It's a one-time trauma, it's a low-grade repetitive trauma, or it's a sustained position, like the position most folks have to work in. So it wears a couple different masks.
Mm-hmm. I feel like we should get up and move around to
practice what we preach, right? I'm comfortable, thank you though.
Dr. Alec, if you could, I know we mentioned the elephant in the room, sort of the fear of the adjustments and sort of repercussions, but if you could just describe in your words sort of what does an adjustment feel like, what does it sound like, anything you want to mention there?
In the moment right before you get adjusted, you'll likely feel a lot of tension build up in the area where you're experiencing discomfort or the area the chiropractor's applying the pressure. And on the other side, a lot of people, especially if you don't know what to expect, you get a little startled by it, but then you feel this neurological reflexive relaxation of the tissue around the segment that was adjusted. You pretty instantly experience some improvement in your range of motion. You know, say if you adjust a neck, a lot of people describe like their head feels like it's floating or that it's on a swivel, and that's just like improved motor function around the adjusted segment. So from a feel standpoint, it's tension. Sometimes you could describe it as pressure, and then lots of relaxation, usually in the area that was adjusted. You may hear clicks, pops, or snaps, or you might not. The sound, technically known as a cavitation, that has very little or nothing to do with the therapeutic efficacy of an adjustment, but rather the speed of the adjustment, how close you got to like taking a tissue into paraphysiological space. Those kinds of things are like a little more meaningful from a therapeutic standpoint, but that's all the things you could experience.
Great, awesome. couple left here. What about if you're pregnant? Is it safe to pursue chiropractic care?
Chiropractic care is exceedingly safe for pregnant women.
Or any contraindications within chiropractic care for those who are pregnant?
Listen, unless your OB has told you something really explicit, if you're a high-risk pregnancy for whatever reason, if they have deemed you, probably if your OB has said like you're not a good candidate for massage or other things like that, we would probably fall into that same category. But if you're a relatively normal pregnancy, or if your OB has cleared you for manual therapy, then it is exceedingly safe. And we 101 ways to modify what we do to accommodate a woman at every stage of her pregnancy. Yeah.
Excellent. All right. Well, I think that's all we have for today, everybody.
Okay.
Thanks for tuning in. If you have any more questions, feel free to leave them in the comments below. Hit the like button, all that stuff you do with YouTube videos, right?
Oh yeah.
Thank you, Dr. Alec, for answering some of our FAQs today, and hope you all have a good one.
Okay. Thank you.